You think you're tired because you're getting older. But what if your prostate is the real reason you're waking up exhausted every morning? Hi, I'm Dr. Ross. In this video, you'll learn why your prostate might be affecting your sleep, what warning signs you should never ignore, and what simple habits help protect your prostate as you get older. If you care about your health, follow this channel. There is one mistake many men make without realizing it, and there is one consequence that slowly steals sleep, energy, and quality of life. We'll get to both. Picture this. You fall asleep without any problem. Then a few hours later, your eyes open. Not because of noise, not because of pain. You suddenly feel like you have to urinate. You walk to the bathroom, return to bed, and try to sleep again. Then it happens again and again. By morning, you feel drained. Many men assume this is simply part of aging. That assumption causes problems. Your body often gives warning signs long before serious prostate symptoms appear. The challenge is that many men ignore those signals. Over the years, I have spoken with many male patients who believed frequent bathroom trips, weak urine flow, and interrupted sleep were things they had to live with. Many of them were surprised to learn that their symptoms were linked to an enlarged prostate. Let's talk about why this happens. The prostate is a small gland located below the bladder. It surrounds part of the urethra. The urethra is the tube that carries urine out of the body. This location matters. As men get older, the prostate often becomes larger. Doctors call this benign prostatic hyperplasia, or BPH. BPH is not prostate cancer, but it can create significant urinary problems. As the prostate grows, it begins squeezing the urethra. Think about narrowing a pipe. Flow becomes restricted. Urine has a harder time passing through. The bladder must work harder to push urine out. Over time, symptoms begin to appear, and many men miss them. Wait, this is important. The earliest signs are often subtle. You might notice that urination takes longer than it used to. You stand at the toilet and wait for the stream to begin. You might notice the stream is weaker. Maybe it no longer has the same force it had years ago. Some men notice dribbling after they finish. Others feel like they still have urine left in the bladder. Have you experienced any of these changes? Many men have. The numbers are significant. By age 60, prostate enlargement affects a large percentage of men. As age increases, the likelihood becomes even higher. That doesn't mean symptoms should be ignored. It means men should pay closer attention. Another common sign is urgency. You suddenly need a bathroom. The feeling arrives quickly. You feel pressure to go immediately. This often becomes stressful when you're driving, shopping, traveling, or attending events. Then comes the symptom that frustrates men more than almost anything else: nighttime urination. Doctors call this nocturia. This symptom affects sleep, and poor sleep affects almost every part of life. You feel less energetic, you have difficulty concentrating, your mood changes, you become more tired during the day. Many men focus on the bathroom trips. What they don't realize is that poor sleep is creating additional problems. This is why paying attention early matters. The earlier symptoms are recognized, the more options you have. Now here's something many men never hear. An enlarged prostate is not simply about size. Inflammation also plays a role. Inflammation affects how prostate tissue behaves. It contributes to irritation, it contributes to urinary symptoms. And certain daily habits can make inflammation worse. Others can help reduce it. We'll discuss those habits shortly. Before we get there, I want you to remember one thing. Your body is not bothering you for no reason. Frequent urination, weak stream, difficulty starting, incomplete emptying, nighttime bathroom trips. These are messages. The mistake many men make is treating those messages as normal aging instead of paying attention. And when symptoms are ignored for years, they often become harder to manage. That is the consequence we talked about earlier. Not simply inconvenience, loss of sleep, loss of energy, loss of quality of life. The good news is that there are practical steps that support prostate health. Some of them are surprisingly simple. One of them involves something you probably do every day without thinking about it, and another has been studied for years but is still rarely discussed. We'll get to those next. This is where many men get it wrong. They notice the symptoms, they know something has changed, but instead of taking action, they adjust their lives around the problem. They memorize bathroom locations, they avoid long trips, and year after year, the symptoms continue. You do not have to approach prostate health that way. Let's talk about habits that support the prostate and help many men reduce urinary symptoms. The first habit is not about drinking more water. It is about drinking water at the right time. This surprises many people. Most men focus on how much they drink. The timing often matters just as much. Here's why. When you do not drink enough water during the day, urine becomes more concentrated. Concentrated urine can irritate the bladder. It can also contribute to urinary discomfort. A better approach is to stay well hydrated during the morning and afternoon. Then begin reducing fluids in the evening. This simple adjustment gives your body more time to process fluids before bedtime. As a result, many men experience fewer nighttime bathroom trips. Think about your own routine. Do you drink large amounts of water, tea, soft drinks, or other beverages late in the evening? If so, this might be contributing to your sleep disruption. Try shifting most of your fluid intake earlier in the day. Many men notice a difference after several weeks. Now let's move to the second habit, and this one helps in a different way. A short walk after meals. That sounds simple, but the science behind it is important. After you eat, blood sugar levels rise. If those rises happen repeatedly over many years, they contribute to inflammation throughout the body. Remember what we discussed earlier. Inflammation plays a role in prostate enlargement and urinary symptoms. Physical activity helps. You do not need intense exercise. You do not need a gym membership. You do not need to run. A comfortable 10 to 15-minute walk after meals is often enough. Walking helps the muscles use glucose more efficiently. This helps reduce blood sugar spikes. Lower blood sugar spikes help reduce inflammation, and less inflammation creates a healthier environment for the prostate. Many male patients look for complicated solutions. Sometimes the most effective habits are surprisingly basic. Hydration timing, daily movement, consistency. These actions add up over time. Have you noticed how many prostate problems develop slowly? That is why small daily improvements matter. Now let's discuss a topic that often receives little attention, but the research is worth knowing. Regular ejaculation. Many men have never heard this discussed in a medical setting. Yet researchers have spent years studying its relationship to prostate health. Several studies have suggested that men with more frequent ejaculation tend to have a lower risk of certain prostate problems, compared with men who ejaculate less often. Researchers continue studying the exact reasons. One theory is that regular emptying of prostate secretions helps maintain a healthier glandular environment. The prostate produces fluid continuously. Regular release helps clear those secretions. From a medical perspective, ejaculation is a normal biological function. Whether it occurs through sexual activity with a partner or through masturbation, the prostate responds in the same physiological way. This is simply a discussion about prostate health. Nothing more, nothing less. Now let's pause for a moment. Have you noticed any of the symptoms we've discussed today? Frequent nighttime urination, weak urine stream, difficulty starting urination, the feeling that your bladder never fully empties? If the answer is yes, pay attention to this next part. Delaying evaluation is one of the biggest mistakes men make. Many prostate conditions respond better when identified early. Waiting rarely improves the situation, and symptoms often become more disruptive over time. That is the warning I want you to remember. Ignoring symptoms does not make them disappear. In many cases, it allows the underlying problem to continue progressing. Many men believe that every urinary symptom automatically means prostate cancer. That is not true. In fact, benign prostate enlargement is much more common than prostate cancer. At the same time, you should never assume symptoms are harmless. The only way to know what is causing your symptoms is proper medical evaluation. That is why regular checkups matter. Now, here is what helps most. If symptoms develop, doctors usually begin with a careful evaluation. This often includes discussing your symptoms, reviewing your medical history, performing a physical examination, and in many cases, ordering tests such as a PSA blood test. Depending on the situation, additional testing may be recommended. Treatment depends on the cause. Some men benefit from lifestyle changes. Some benefit from medication. Others may require additional procedures if symptoms become severe. The important thing is getting accurate information early. Men wait for years because they hope symptoms will disappear on their own. Then they wish they had addressed the problem sooner. So what should you do starting today? First, pay attention to your urinary symptoms. Second, move most of your daily hydration earlier in the day. Third, stay physically active and include regular walks whenever possible. Fourth, schedule a medical evaluation if symptoms are persistent or worsening. These steps are simple, but they matter. Let's also talk about prevention. Protecting prostate health is often about daily habits. Maintain a healthy body weight. Stay physically active. Manage blood sugar levels. Avoid smoking. Follow up with your doctor regularly. Do not ignore changes in urination. Here are some simple do's and don'ts. Do stay hydrated during the day. Do stay active. Do seek medical advice when symptoms appear. Don't assume every symptom is normal aging. Don't ignore repeated nighttime urination. Don't postpone routine prostate evaluations. You should contact a doctor promptly if you notice blood in the urine, inability to urinate, worsening urinary symptoms, unexplained weight loss, or persistent pelvic discomfort. Those situations deserve medical attention. Before we finish, remember this. Your prostate affects more than urination. It affects sleep. It affects energy. It affects comfort. It affects daily life. The sooner you respond to warning signs, the more options you usually have. Watch for these signs. Act early. Most men wait too long. Don't make that mistake. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you want simple, clear medical guidance like this, subscribe and stay informed.